Pop quiz. The nurse performs a home visit for a client with Parkinson's disease. Which recommendations would be appropriate for this client? Select all that apply. All right, guys, how do you treat select all that apply? As true or false? Let's go. Arrange furniture to allow extra space for movement. True. Patients with Parkinson's, one of the concerns is going to be safety falls. Whenever you're thinking of Parkinson's disease, I want you to think of TRAP symptoms, TRAP. T is for the tremors that they have. R is for, what's my R stand for? Rigidity. A is for akinesia, and P is for postural instability. One more thing I want to add to that, besides the trap, another concern that we have for these type of patients is we're concerned about aspiration because they have chewing and swallowing difficulties, and we don't want them to choke, okay? So anyway, that one's true. Next, eat a low-calorie, carb-rich diet to maintain a healthy weight. Well, that's false. If anything, they tend to lose weight because of the chewing and swallowing difficulties. By the way, guys, that patient with a Parkinson's, if you even suspect that they're having chewing or swallowing difficulties, the registered nurse is the one that's responsible to ask the healthcare provider for a speech evaluation. And that with that speech evaluation, they'll do the swallow study. All right, moving on. Get up slowly to avoid the dizziness that medications for Parkinson's disease may cause. True. Absolutely. They can end up getting postural hypotension, or they could just have dizziness, and that is going to be a fall risk. So that's absolutely true. Next, install grip bars on the wall of your shower bath. True. Why? Because they are huge fall risks. And the reason for that, guys, remember the trap symptoms I told you about, the TRAP? Well, the A is for akinesia, and that P, postural instability. They're not moving the way they used to, and they're not stable because I'd have to show you. But anyway, the way that they walk with that shuffling gait and the center of the gravity has been moved, they're a big fall risk. So that's true. Next or last, what does that say? Prepare a bedroom on the first floor of the home. Yes, we don't want them climbing stairs. Remember, big fall risk. So when you think about the Parkinson's patient, you're concerned about aspiration, you're concerned about falls, you're concerned about safety.